Which of the following best describes the primary rationale for using deep hypothermic circulatory arrest, DHCA, during cardiac surgery? A. To improve myocardial oxygenation. B. To increase cerebral metabolic activity. C. To reduce metabolic rate and protect organs during circulatory arrest. D. To enhance coagulation function during bypass. Answer: C. To reduce metabolic rate and protect organs during circulatory arrest. Explanation: DHCA is used to significantly lower body temperature, usually to 15 to 18 degrees Celsius, to reduce the metabolic rate of organs, particularly the brain. This allows for a period of safe circulatory arrest during complex surgeries, such as aortic arch repairs, where blood flow must be temporarily stopped. At what core temperature is deep hypothermic circulatory arrest, DHCA, typically initiated? A. 28 to 32 degrees Celsius. B. 20 to 25 degrees Celsius. C. 15 to 18 degrees Celsius. D. 10 to 12 degrees Celsius. Answer: C. 15 to 18 degrees Celsius. Explanation: DHCA is initiated once the patient's core temperature reaches approximately 15 to 18 degrees Celsius. This level of hypothermia provides maximal protection against ischemic injury, especially to the brain, during periods when blood flow is deliberately halted. What is the typical safe duration for deep hypothermic circulatory arrest to minimize the risk of neurological injury? A. 5 to 10 minutes. B. 15 to 20 minutes. C. 25 to 30 minutes. D. Over 60 minutes. Answer: C. 25 to 30 minutes. Explanation: Neurological studies have shown that DHCA is generally considered safe for up to 25 to 30 minutes. Beyond this duration, the risk of neurological complications, such as stroke or cognitive dysfunction, increases significantly, even with deep cooling. Which of the following is a major complication associated with DHCA? A. Pulmonary embolism. B. Renal artery stenosis. C. Coagulopathy and bleeding. D. Hyperthermia-induced seizures. Answer: C. Coagulopathy and bleeding. Explanation: Hypothermia impairs the enzymatic function of coagulation pathways and platelet function, leading to an increased risk of coagulopathy and bleeding during and after DHCA. This is one of the key postoperative concerns. Which cerebral protection strategy may be combined with DHCA to prolong safe arrest time? A. Mild hyperthermia. B. Retrograde cardioplegia. C. Antegrade cerebral perfusion. D. High-dose corticosteroids. Answer: C. Antegrade cerebral perfusion. Explanation: Antegrade cerebral perfusion, ACP, can be used in combination with DHCA to maintain some cerebral blood flow during arrest. This helps extend the safe duration of circulatory arrest and improves neurological outcomes, especially in high-risk surgeries. Which of the following best describes the effect of hypothermia on cerebral metabolic rate during DHCA? A. It increases exponentially. B. It remains unchanged. C. It decreases linearly by 50% at 35 degrees Celsius. D. It decreases by approximately 6 to 7% for every 1 degree Celsius drop in temperature. Answer: D. It decreases by approximately 6 to 7% for every 1 degree Celsius drop in temperature. Explanation: Cerebral metabolic rate for oxygen, CMRO2, decreases by about 6 to 7% for every 1 degree Celsius decrease in body temperature. At 18 degrees Celsius, the metabolic rate is reduced to about 10 to 15% of baseline, which provides neuroprotection during circulatory arrest. Which monitoring modality is most useful in assessing cerebral oxygenation during DHCA? A. Electrocardiography, ECG. B. Pulse oximetry. C. Near-infrared spectroscopy, NIRS. D. Capnography. Answer: C. Near-infrared spectroscopy, NIRS. Explanation: NIRS provides continuous, non-invasive monitoring of regional cerebral oxygen saturation. It's commonly used during DHCA to ensure adequate cerebral protection and perfusion strategies are effective. Which of the following statements is true regarding rewarming after DHCA? A. Rewarming should be rapid to minimize bypass time. B. Rewarming must be controlled to avoid cerebral hyperthermia. C. Rewarming is started before restoring circulation. D. The target temperature is usually less than 30 degrees Celsius. Answer: B. Rewarming must be controlled to avoid cerebral hyperthermia. Explanation: rapid or excessive rewarming can cause cerebral hyperthermia, leading to neuronal injury. Rewarming should be slow and carefully monitored to ensure the brain temperature doesn't exceed 37 degrees Celsius before complete normalization of perfusion. Which of the following is not an indication for using DHCA in cardiac surgery? A. Aortic arch aneurysm repair. B. Complex congenital heart surgeries. C. Coronary artery bypass grafting, CABG. D. Pulmonary thromboendarterectomy. Answer: C. Coronary artery bypass grafting, CABG. Explanation: CABG typically does not require circulatory arrest or DHCA. DHCA is reserved for surgeries where blood flow must be halted completely, such as in the open repair of the aortic arch or certain congenital and pulmonary surgeries. During DHCA, which of the following electrolyte disturbances is most commonly observed and must be closely monitored? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hypocalcemia. Answer: A. Hyperkalemia. Explanation: during DHCA and subsequent rewarming, cellular shifts and membrane instability can lead to potassium release from cells, causing hyperkalemia. This can lead to arrhythmias and must be corrected promptly.